Since this symposium is for almost an hour, out of which 45 minutes have been given to me and 15 minutes sir is going to talk, I will take this opportunity to start my presentation. I also take this opportunity to welcome my PG teacher, Dr. Professor Khaire sir, who is sitting in this hall, who has recently retired as the Dean of the Government Medical College, Ambejogai. So, very warm welcome, Khaire sir. My inspiration was David F. Chang, whom I had the opportunity to see some of his surgeries, and through which I learned the art of horizontal chopping, which ultimately transformed into a pre-chop surgeon. Also, I was inspired very much by this Japanese surgeon. Everybody is knowing him, Takayuki Akahoshi, who is also an innovator in the cataract surgery, which I have the fortune of meeting him also. And of course, the cyber guru of India and the world, Dr. Pradeep Mohanta sir, who keeps on inspiring the young as well as the senior phaco surgeons all over the world. And for a very long time he was using my pre-chopper. Now he has come with his own design called as Mohanta's pre-chopper, which I'm sure he's going to show us some of the nice surgeries. My guru, Lahane sir, my teacher, Shastra Buddhe sir. So what are the advantages of chopping? When you do a chopping, there is a reduction of the phaco energy delivered, and there is a reduction in the stress to the zonules and the capsular bag, which gives you an opportunity to perform a supracapsular emulsification, and there is a decreased reliance on the red reflex, and there is a greater reliance on the chopper than a phaco tip. And then why pre-chop? It is a technique of mechanical nucleofractice performed under viscoelastic prior to phacoemulsification, and it mechanically divides the nucleus without the use of phaco or a femto laser energy. Advantage of pre-chop is that the phaco energy is drastically reduced, thereby the phaco time, aspiration time and the amount of balanced salt solution used in the antechamber are also reduced, thereby reducing the endothelial damage. And even in the weak zonules, it is very effective, as I am going to show in subsequent videos. In short, it makes the phaco surgery faster, easier and safer. Compared to a femto-assisted cataract surgery, we all know is a very expensive viable option, but may not be within the reach of every ophthalmologist in his lifetime also. It is also restricted by the pupil size and is a problem in a deep-seated eye, and we know now recently that cystoid macular edema is one of the complications of a femto-laser assisted cataract surgery. This is something which has been on the blog, and they are talking a lot about MyLoop, but it also has got a steep learning curve, and PCR is a very known complication encountered. Those who are using, they do agree that PCR is a very known complication. Akahoshi forceps now were tried by many, including myself, but they have a steep learning curve, anterior chamber instability, and there are different pre-choppers for different grades of cataract, making it really confusing. So I have come with a patented design which is sleek and which doesn't have a cross action like a Akahoshi forceps, and I am using in all my cases a side pod instrument which you can use as a Akahoshi ball sustainer, but I am a great fan of Chang's horizontal chopper, but you can also use a ball sustainer. It has a very sharp cutting edge to cut the nucleus of any density. A very diagrammatic representation of what in the diagram 1 how the pre-chop proceeds, and in 4th you will see, and subsequently 4th and 5th and 6th, the entire endonucleus has been divided into 2 halves and finally into 4 quadrants. This is one of my PG, this is the diagrammatic perception of what she saw in what I was doing. So we are now talking of rather than working very hard, we are working little more smarter, forgetting the story of the crow uncle long ago when we as a child used to listen to the story. Now let us see the dynamics of pre-chop in vitro, I am just marking a capsular axis-like thing on the nucleus. This is a ball sustainer, Akahoshi's ball sustainer, popularized nowadays by Nato Rosatelli also. Is a little much longer one. So you have to actually go along the endonucleus surface and then go below the capsule. So this is the only intimidating and frightening step for most of the transition surgeon. This is a Chang chopper which I am again scratching along the endonucleus and going below the below the rhexis margin and stabilizing. And on in my right hand is this my pre-chopper which I am negotiating through the 2.8 millimeter incision. And once I stabilize the nucleus, I just go a little anterior to the capsular axis margin, make it now vertical because I have to negotiate the tunnel. So initially I will be horizontal. Once I am in the antechamber, I will make it vertical. Just try to go into the softer part of the endonucleus, which is the periphery, and then keep on advancing. At the same time, stabilizing my left hand Chang chopper and then producing a crack. This portion, which is the trailing portion of the endonucleus, does require some manipulation in hard cataract to separate the two fragments. And once you rotate them, you are ready now for doing further amount of pre-chops so that the final outcome will be 4 quadrant that can be emulsified with the help of phaco energy. So this was in vitro movement, perception. Now we'll talk of what you can see from the side. So this is right hand, sorry for the minified view. In the right hand my pre-chopper is there. In my left hand is the sustainer or a Chang chopper. So initially you have to go into the tunnel. There is a little bit of for a beginner there may be little struggle because you have already inflated the antechamber. But once you learn that, now this is the way you go it horizontally and then you make it vertically. This was the first video, which was an award-winning video. Enlarge it. Voice is there. And is fraught with complications like wound, endothelial damage and PCR. Hence, phacosurgeons are shifting from the classical 4-quadrant cracking method to direct chopping techniques. Of late, FLACS, that is the femtolaser assisted cataract surgery, being an extremely expensive option. Therefore, pre-chopping the endonucleus is still a cheap and viable option for us to reduce the collateral damaging potentials of phaco energy. We in this video presents a newly designed pre-chopper well suited for all grades of cataract, especially the harder ones. Pre-chopper goes through 2.8 millimeter incision and the left hand uses a Chang chopper to hook the equator of the endonucleus in all these videos. This is a second video demonstrating the intumescent cataract wherein the surgeon is aspirating a liquid cortex with the help of 26 number needle, capsular axis being completed and pre-chopping being attempted. The entire endonucleus now is divided into 2 endonuclei, heminuclei I mean to say, and after rotation again the pre-chopper is dividing a heminuclei into 2 fragments. Phacoemulsification is now being carried to empty the capsular bag of the nuclear fragment. In this third video, we are demonstrating a dense nuclear cataract being pre-chopped with the help of this new pre-chopper. The endonucleus being hooked, the pre-chopper is dividing the endonucleus into 2 halves. This is a viscoelastic dependent technique. And what you need to appreciate is that the fragments which are produced are almost imitating the fragments which are produced by femtolaser. They are very steep. They have a very steep borders. This pre-chopper is also very helpful for dealing with a soft cataract, which at times can produce a cheese wiring when you are using a high vacuum and phaco energy. This elegant pre-chopper is therefore well suited for all varieties of hard as well as soft cataract. Being sleek, the anterior chamber is well maintained, and this is compatible with 2.2 and 2.8 millimeter incision. It doesn't resemble any cross-section forceps like a classical Akahoshi pre-chop forceps. The learning curve is not very steep and is definitely very easy to master. This is the last video of this video presentation where the capsular axis was lost because of the high intralenticular pressure in a intumescent cataract. The end result was a disastrous Argentinian flag sign, and to proceed or not is always in the back of a mind, because we don't want to confront a catastrophe like a nucleus drop during phacoemulsification when the capsular axis is lost. These capsular flap, irregularly torn flaps, are converted into what we can call it as a pseudo capsular axis, and because the pre-chopper is dividing the nucleus, the other pole of the nucleus being hooked by the Chang chopper, the energy is against each other, and therefore this becomes a very safe option for the phacosurgeon to divide the nucleus. So even in loose zonules and where the capsular integrity is not 100%, we can do a phenomenal nice pre-chop. Thank you very much. No, sir, I have some more to go, sir. So how this can be applied, I am going to show with an example. We have ample time. Almost more than 45 minutes have been given to us. Strategy for nuclear disassembly is the greatest myth in the world of phacoemulsification. I am presenting a consistent single recipe to deal with all forms of cataractous nuclei through the art of pre-chopping. Though Akahoshi pre-chop forceps were introduced as a wonder device, but it had a steep learning curve with a phenomenal anterior chamber instability. Soft cataracts are intimidating and challenging even for a seasoned phacosurgeon because of the poor hold they provide during chopping and the phenomena of cheese wiring. After ensuring optimal rhexis, anterior debris clearance, hydrodissection and adequate nuclear rotation, this sleek and elegant pre-chopper makes the ordeal of nuclear division quite easy and effective. In this white cataract, which is a soft cataract, Chang's horizontal chopper goes through the side port to stabilize the equator of the nucleus, and the pre-chopper with its sharp edges goes through the main 2.8 mm incision and dips deep into the endonucleus just anterior to the capsular axis margin. These two instruments moves towards each other to produce a nice pre-chop. Further rotation in pre-chopping produces 4 pie-shaped quadrants to be emulsified at the anterior capsular plane. In a dense cataract, obtaining a pristine cornea day 1 post-op is indeed a challenge. Let's face it valiantly with copious viscoelastic and performing maximum number of pre-chop to minimize the effective size of the endonucleus. Of course, you can stabilize the equator of the nucleus either with a Chang's chopper, or you can use an Akahoshi ball sustainer, which I am going to demonstrate in the subsequent videos. wolf in sheep's clothing is an apt analogy when you confront a leathery cataract hidden in a docile looking white cataract. So let's not panic. Let's apply patience and perseverance to perform the pre-chopping the hard endonucleus into multiple pie-shaped fragments. Once you divide this leathery cataract into multiple quadrants, this becomes a very effective strategy to minimize the endothelial damage. I'm using an Akahoshi ball sustainer as an equatorial stabilizing device in this particular video. Sometimes in order to completely separate the posterior plate, you have to also use dialer-like instruments to mechanically separate them so that all these pie-shaped fragments are not attached to each other. PXF and zonular weakness is never a problem if you have mastered the art of horizontal chop. Here, stretch pupilloplasty is being performed and the Chang's chopper hooks the equator of the nucleus and a successful pre-chop is thus performed. Once you divide the entire endonucleus into two halves, subsequent emulsification and subsequent chopping becomes quite easy. Conquering a very hard granite cataract requires a lion's heart, copious viscoelastic, and patience is the key. You may notice a little bit of torsional instability in that, but with patience you can overcome once you divide the entire endonucleus into two halves. What is so unique, as is evident in the video clip, is that the fragments which are produced are having a very steep margins and they are imitating almost the margins which are produced by an femtolaser assisted cataract nuclear disassembly. Have to be used to prevent the interchamber shallowing during these maneuvers. Argentina emulsification at the caution. Perform a controlled hydrodelineation, not doing a nuclear rotation and preventing interchamber shallowing is the mantra, perfect mantra for successful outcome. Let's simplify this fierce polar bear by performing pre-chopping and dividing the endonucleus into two halves and emulsifying them without any rotation. Really fortunate that there was no pre-existing dehiscence once the cortex was cleared, as is evident. Thank you very much. I am going to skip a video. If time permits, I am going to show this SICS, how this pre-chopper can be used in SICS. So I am going now to some clips of 1 minute each. I'm using a little bit of chondroitin sulfate to coat the endothelium in a comparatively dense cataract. In soft cataract especially, the quest only is to divide the nucleus into two, because that you can just lift those endonuclei, have divided endonuclei and then emulsifying them. So you don't require 4 quadrant pre-chop, you just have to divide it into two and then subsequently emulsify at the capsular plane. Another soft one I am showing. So after the capsular axis hydrodissection and rotation, which is very important in this pre-chop, then you have to start your pre-chopping. Hydrodelineation ring serves as an definitive guide as to where your horizontal chopper should be. In a comparatively small pupil, stretched pupil plastic can be done either with a Coughlin hook, but I am right now using a Y hook, performing a single sphincterotomy so that my apprehension of catching hold of the iris at 6 o'clock is minimized. That really helps me, and then you can do pre-chopping in a small pupil or exfoliation. Initially it did happen that every time I was doing pre-chopping, I was putting visco, coming out and then performing pre-chop and again putting visco. Now I have learned that pre-chopping can be performed in a single go also without damaging the epithelium, which I am going to demonstrate here. So once you rotate the nucleus, you stabilize the 6 o'clock of the endonucleus and then perform pre-chop, keeping both instruments in the interchamber only. This is pre-chop in the white cataract. regarding the views in small incidents already on the YouTube. If you have leisure, do have a look at the views of the pre-chopper in